We regularly encourage people to do self-skin examinations, probably every 1 to 2 months, taking the time to get out of the shower and taking a good look at themselves in the mirror. We tend to put emphasis on the ABCDEs of melanoma, where we're looking to see, are there moles that are asymmetrical, meaning one side looks very different from the other side. We like to look at the borders of our moles to make sure that they're crisp, that you can really tell where normal skin ends and a mole begins. We like to see with the color that it's the same color as the other moles on the skin. Most people generally make the same colors of brown to most of their moles. So if one mole pops up and it's black, or it's a reddish brown or multiple colors in it that looks different from the rest, those are the ones we want people calling in and asking to be examined. We also look to see about diameter. If it's greater than 6 millimeters in size, we tend to have people get those checked out, especially if they have no other moles that are exceeding that size. And then finally, E is for evolution, and that's just a mole that has been changing over time. And that's what I find as a dermatologist, people are very good at finding on themselves and coming in. So when somebody comes in and tells me exactly how a mole has changed, it generally cues both of us in to the fact that there's something that needs to be examined there. So other warning signs that we tend to ask people to watch out for are wounds that just won't heal. You typically know how long it takes your body to heal from a scrape or some trauma that you got to your skin. And if something is staying for longer than that amount of time, so if something wants to bleed on its own or will not heal up in a 2 to 3 month period, it needs to be checked. That is one of the most common ways we tend to see basal cells and squamous cell carcinoma present. The other thing is if you're just washing your face at night and something wants to bleed on its own that you haven't picked at and it's just happening spontaneously, that's another really common way that we see a lot of precancers and skin cancers present. We typically see more stuff occurring on the face, neck, and arms, which are the areas that we've all gotten more chronic skin damage. So those areas, I have my patients really be focused on any abnormalities that are coming up.